executive staff that will be sharing and answering the questions that you all have submitted over the past couple of weeks. I'm going to turn it over to you, Amy, and let you share some updates since I last meeting.
Okay, thank you. Okay, we had a few technical difficulties getting going today, so thank you for bearing with us. Just a few glitches. I just want to share an update on our numbers across the district, across our 10 counties, again, and where we are with our COVID response. I'm going to attempt to share my screen and show you our case summary from last night. And you should be seeing that now. So the first column is our county names. The second column there is the number of active cases in each column. So for our district total at this point in time, we have 849 total active cases currently. I'll read off quickly. If you're just listening and not being able to see the video for this, I'll just read off the totals by county just quickly. Adair currently has 84 active cases, Casey 97, Clinton 41, Cumberland 22, Greene 67, McCreary 78, Pulaski 196, Russell 97, Taylor 121, and Wayne 46. And that's for a district total of 849 active cases. The far right-hand column of the screen that you're seeing now, this chart, shows that we reported 199 active or new reports of cases yesterday across the 10 counties. That is about average for our new number of cases per day for the last week or week and a half or so. We've been seeing anywhere from 150 to 250 cases on average per day that we're able to get worked. There's actually more cases than that coming in, and we are struggling at this point in time to get all of the positives contacted and worked and reported in a timely manner. So we are slightly delayed on the reporting at this point, probably 2 to 3 days, I would estimate, behind. So the state is also behind on some of their reporting. If you are familiar with the color-coded map that the state uses to show the severity or the transmission rates across the counties, the critical zones, and the accelerated and all that, the yellow, green, orange, and red colors. The state is still showing, I think, 3 of our counties as not red, but that's because they're behind on reporting some of our cases that we've reported to them. So they're behind, we're behind, but our local data on our webpage, which is LCDHD.org, is the most up-to-date information that we can possibly offer you at this point in time. And according to our data, at this point in time, all 10 of our counties are firmly in the red categorization of high transmission. So that is where we're at. So there is a discrepancy in the state map and our map, and that's because of a delay in reporting and getting things just accounted for and on the map. But you'll notice that a month or so ago, the state map was showing lots of green counties and yellow counties, and over the course of the last month, pretty much the entire state now has gone red. So our 10 counties certainly are red, according to our local data. One thing I want to address is the hospitalization numbers. I've had a lot of questions this week about that, and you'll see that we reported in that the hospitalized column on my screen, if you're still looking, 47 hospitalized cases. That information is only available to us when we are notified of a hospitalization. So we don't always know when people go into the hospital. When we work a case, when a case comes into us, a report, and we contact that case, if they're not hospitalized at that moment in time, we give them instructions on how to take care of themselves, what symptoms to watch for, that kind of thing. And then we give them a quarantine, an isolation period time, a time when they're going to be out of isolation. And we don't contact them again. We just trust that they're going to follow our instructions and that they know what to do. And we give them instructions on if their symptoms worsen, how to handle that. And then we are not able to call them back day after day after day and double check on them. So we don't always learn of hospitalizations is my point. There are lots of times where people are okay the day that we contact them and they're at home and they're treating their symptoms and they're doing fine. And then over the course of the next week or so, they may worsen and have to be hospitalized. So those are the numbers that we don't know. And a couple of days ago in my daily reports that I put out on our webpage and through social media and our emails, I made a statement that said however how bad you think the numbers are that we're reporting now, and these do look bad, 200 plus cases a day looks pretty bad. And our red zone counties, that looks pretty bad. The real-time picture of what's out there in our communities is probably worse than what I've reported, because we just can't keep up and we can't know everything all the time. So that's just, it's not to scare anyone into anything. You know, it's not trying to create panic or anything. It's just letting you know that we realize that our numbers are off and we can't possibly do any better than what we're doing to kind of keep up with this. You know, we are working every available LCDHD staff member all the time on COVID. We have pulled in, you know, everyone from every program that we possibly can, and we're struggling to keep up. We have hired a new staff, additional staff in counties where we need it. It's just a lot at this point in time. We are back to the same level of increase that we saw during our worst months of this back in December, January, February timeframe. So that's where we're at. And I really don't say that to alarm anyone. I just want you all to understand this is where we are. Let me stop my share here. Actually, while I'm here, let me go ahead and share this next document that I wanted to talk about. This was put out by the state this week, and you may have seen this on the news or, you know, social media, websites, whatever you're seeing. But this is a quarantine and isolation guidance that the state came out with, and it's slightly different than what you may have heard. You've probably always heard 14 days or 10 days, kind of those numbers tossed around. This is a much more standardized approach to quarantine and isolation, and they're calling it the 10-10-10 approach. So I just wanted to make you all aware of this. It's if you've been exposed or tested positive for COVID-19. So the first 10, if you have tested positive for COVID-19 and have symptoms. So you're symptomatic, you have sniffles, you have a runny nose, you have a cough, you have a fever, you have an upset stomach. I mean, there's a whole list of symptoms this could be. You should isolate for 10 days from the day the symptoms began. This is for COVID positive people. This is with a test. So 10 days from the date of your symptom onset is the isolation period recommendation now. If you have tested positive for COVID-19 and have no symptoms, you're asymptomatic, but you have a positive test, that is still the same. That's the second 10. You isolate for 10 days, and that would be from the day you had the test done. Since you don't have symptoms, you have to have a beginning date. So we'll use the day you had the test done as your first day. The last 10 on here is if you have been in close contact with someone diagnosed with COVID-19. So that would be a contact. You're going to recommend quarantine for 10 days from the last exposure to that COVID positive person. Now there is a asterisk there on the quarantine. So you can see that at the bottom, that if you're fully vaccinated, you may not need to quarantine. So that's the benefit of having the vaccine, that they are not recommending quarantine for vaccinated individuals in that kind of situation. It is still recommended that you get a test done on day 3 through 5, somewhere in that range after your exposure, just to verify that you are not positive also. So that is the big difference in the guidance that's out. This is the new thing that just came out from the state this week. It is still possible, and Laura will probably mention this, but it is still possible to shorten your quarantine. So if you're wanting to do the shortened quarantine and you test between days 5 and 7, I believe it is, Laura, that I'm out of my realm here and it's not on my slide. So if you're testing between days 5 and 7, then you can come out of quarantine on day 7, after day 7. So that would be a shortened quarantine option. Very confusing and constantly changing. A lot of this is changing because the virus itself is changing. I had heard a report this week from Dr. Winter, who's one of the state doctors and epidemiologists at the state health department, and she said that this Delta variant has a shorter incubation period than some of the other variants of COVID early on, when it was recommended with 14 days of quarantine. So she said typically the people who have Delta variant will get sick quicker than people who may have had the Alpha or some of those other earlier strains of COVID. So that's one reason that they have shortened and changed some of these guidelines. As the virus itself changes, the guidelines change also. Want to also share just another brief, let me get my screen shared here. One more thing I want to show you. just on the volume of cases that we're seeing. So this is a chart. I tried to look back over the last 3 months or so, and this is how our increases have occurred. So you'll see the county in the first column, the number of cases that was reported for that county in the second column there for June, and then we have July, and then we have August. And you have to remember that August data is only available through yesterday, which is 8/17. So we still have almost 2 weeks of data to add to this August column. And you can see that for the entire month of June, for our 10 county district, we reported 285 cases across the 10 counties. For July, that increased to 1,016 cases. And already for the first 2 months or 2 weeks or so of August, we have already hit 1,882 cases. So the increase from last month, from July to August, is already 866 cases additional. And that's basically into 2 weeks and a couple of days worth of work. We are seeing cases pretty much everywhere. It's all over the community. It's in every type of setting you can think of: workplaces, churches, daycares, everything that could possibly be a gathering place and a gathering point. That's where we're seeing cases. There are a small number of breakthrough cases that are occurring. Dr. Wayman, I think, is going to mention that maybe in a minute. But the breakthrough case is someone who is fully vaccinated but then tests positive. And so that is happening to some degree. It's still around, I think, 10 to 15%, maybe at the most, of cases that we're seeing. So 85 to 90% at least of cases that we're reporting are unvaccinated. So we strongly encourage people at this point in time to get a vaccine. They are readily available at all counties, retail pharmacies, health departments, doctors' offices, providers. It's pretty easy to find a vaccine, but if you need help locating one and are interested in getting one, certainly call your health department and we will help you manage that. I think that is about it. Maybe I should say too, Tracy, I think you asked me to talk about booster doses. We'll just mention that quickly, and I think Dr. Wayman has more information also. This week, you've probably heard a lot about a third dose, a booster dose being recommended for certain groups of people. At this point in time, it's a very, very narrow group of people who are going to be recommended to receive a third dose. However, there has been a statement released earlier today that says that the general public, more people, will be allowed to have a third dose of vaccine by the end of September. So it's on the horizon. The CDC, the FDA, some of these groups that study this stuff and look at it are looking at the potential of having this vaccine wane over time and lessen its effectiveness. And they're certainly on top of that. And they're making recommendations in real time as they see needs that are occurring and things that could be dangerous to us. So when they recommend a third dose, when it's your turn and when it's available widely for everyone to do, I encourage you to take that too. It would have to be 8 months after you finished your second round of the first doses of vaccine. It's kind of getting confusing how you say it, but it's only Pfizer and Moderna at this point that has this approval. Johnson & Johnson has not been approved for another additional dose. So it would just be Pfizer and Moderna, and it would have to be 8 months past your completion of the vaccination series already. So when the September time comes, if it's the end of September when that's available, we would be looking at people who may have been vaccinated in late December or early January first, the first round of people, and then it will roll out, as the 8 months progresses past the dates. So hopefully that makes sense. And Dr. Wayman, I'm sure, will shed more light on it and explain it much better. Thank you, Tracy. Let me know if there's anything I can do question-wise.
Thank you, Amy. Okay, we're going to go ahead and start with the questions. And I think you touched on this just a little bit maybe, but question number 1 is explain the difference in quarantine versus isolation for vaccinated people. Laura?
Okay, so regardless of vaccination status, if someone tests positive for COVID, they need to isolate themselves away from others for 10 days after their symptoms first began. So if you do have a positive COVID test, it does not matter if you've had vaccine or not. Quarantine is a term that's used for contacts of positive cases. And quarantine generally is for 10 days, as Amy talked about.
Thank you, Laura. Next question. If you are vaccinated and someone in your household is a positive case, do you have to quarantine?
If you're
I'll
go ahead.
answer that one because it sort of adds on to your answers of the previous question. So as long as you're asymptomatic, no, you do not have to quarantine. However, since the vaccine is now only approximately 60 to 70% effective against infection because of the Delta variant, you should be very cautious and try and keep away from people who are vulnerable, and obviously wear a mask. And the recommendations by the CDC is that you test it around day 3 to 5, because vaccinated people can get infected and they can be asymptomatic, but yet they can spread the virus.
So Dr. Wayman, the vaccine at this point is still effective against severe illness, hospitalization, that kind of thing, but it is lessening its effectiveness on actually catching the disease.
Correct.
It is
So
possible.
it is still very effective at preventing you from going into hospital, somewhere in the 90% range. So it is still worth getting vaccinated, because we don't want to go to the hospital and we don't want to get very sick. We don't want to go on a ventilator and we don't want to die. But the second question is the next question is also associated with this.
That's what I was just looking at, Dr. Wayman. So the second question, it asks about reinfection rates of those who have recovered is lower than the rates of those infected after being fully vaccinated. So it's asking, the report says 0.73% are reinfections and 3.83% contracted the virus after being fully vaccinated, breakthrough cases. If this is correct, then why should those who have recovered get vaccinated?
Okay, so obviously any kind of boost in your immunity is a worthwhile thing. So if you have natural immunity, boosting with a vaccine just helps you stay away. It's more is better. Also, there was a study done where two groups of people were compared. They were both people who had previous infection. Some of them were not vaccinated and some of them were vaccinated. And the ones that were vaccinated had much lower rates of reinfection. So that's probably the reason to get immunized. Of course, natural immunity wanes just as does vaccine immunity. So rather than getting reinfected and be re-immunized by infection, let's get vaccinated and boost our immunity that way.
Thank you, Dr. Wayman. Next question. Do we know the percentage of people in the ICU there that are vaccinated? Do we have that information?
I don't, but I know that the number is small from everything I hear from the CDC and from Kentucky Department of Public Health.
I think I tried to address that a little bit early on too in my opening about hospitalizations and not being able to stay on top of those numbers because of the ever-changing, just the constant in and out of people being in and out of the hospital and that status changing. I will also say that you may have heard talk of bed availability at the hospitals being limited in some cases and in some areas. That is certainly true across the state and across multiple states, across the southern part of the United States. There are instances where it's getting extremely difficult to find beds and placement for people. So just knowing that the hospitals are full and doing all they can to try to take care of everyone there. Now, when I say they're full, that doesn't necessarily mean they're full of COVID patients. At this point in time, very few hospitals have cut back on their services like they did during the peak of things a year or so ago, where they were stopping elective surgeries and they were, discharging patients, early and the things that they did back then that have not had to get to that point yet. So when I say they're full, it's not just all COVID. However, COVID is a significant number of things that they're seeing. So we do not have a number on ICU patients in the vaccination status necessarily at this time. I'm with Dr. Wayman. I hear anecdotally, I hear talk, the doctors or the hospitals will say, just off the cuff things to me, but I don't have a hard concrete number, of things that I can share with you all. And that's just where it is. And it's too fluid to change. It would require a constant phone call, person calling every hospital all the time to try to maintain this. And that would take people at the hospital away from, giving patient care and some of the things. So we are doing all we can to report the numbers as we know them. Just know that it's worse even than what we're saying.
Next question. Are there any pediatric cases hospitalized in the Lake Cumberland area?
There likely are, and I will say again, we just don't know. There may be some who have been hospitalized since we spoke to them, and we don't know of those. I will say that if you're seeing the numbers that are reported about ICU status and the amount of beds in ICUs that are full and the amount of ventilators in use in the region and things like that, some of that information is in our daily reports that we send out. It always looks terrible for our region on the ICU capacity because we have a very small number of ICU beds that are here in our region. It's a small region. We have a lot of critical access hospitals, small hospitals that don't have an ICU component. So we only have a limited number of ICU beds. So when it says that they're 91 or 93% full of their ICU beds, it's a small number of beds to begin with. So I will say that, and I will say it's not everyone in ICU is not a COVID patient. So there's that also. Our hospitals, when I say that their capacity is being challenged or being, tested, it's really that they have the beds and they have the space. They have space they can do patient care. The challenge across the board right now for hospitals, long-term care facilities, everywhere. I mean, retail food, fast food even. The problem now is staffing. We do not have enough staff to get people, working and fully be able to staff these shifts that are needed at the hospitals and the level of care and skill and the skill sets that are required. Staffing is a major concern right now. So some of our hospitals do have beds available. They are not staffed beds. They do not have staff to put a patient in those beds and take care of them. So that's another challenge. The pediatric ICU or the pediatric hospitalization numbers that you're asking, Lake Cumberland, typically our region, if we have a critical pediatric case, those typically get transferred to Lexington or Louisville, or a bigger facility that has pediatric critical care treatment options. So it's entirely possible, and it may even be likely that we have pediatric cases that are critically ill and in the hospital. I just am not aware at this moment about that.
Thank you, Amy. Next question. Why are the breakthrough cases of fully vaccinated people not reported as well as the type of vaccine? Do you know where I can find this information?
So generally, we do know what vaccines those people received, but it's not tabulated anywhere or shown on any website. The 3 vaccines pretty much are evenly distributed in those who have been vaccinated and have disease. So they're all about the same efficacy.
The next question is, even though I've been fully vaccinated, should I get tested frequently?
So if you've been in contact with someone who is known to be positive, it's recommended, as we've mentioned before, that you get tested somewhere between day 3 and day 5. If you're symptomatic at any point, whether you've been in contact with someone that's positive, then yes, you should get tested.
Next question. What is the time frame for someone to receive a call from the health department after they have tested positive?
So as been mentioned before, we're extremely behind we're caught up to probably about 2 days right now behind, but it also depends on when we receive the positive lab from the provider, which sometimes, that's varied also. So we try to give you a call in the first couple of days that we receive the positive lab result, but you can refer to our social media and CDC website and Kentucky COVID website for further instructions on what to do. Anytime anyone is positive, they need to isolate themselves.
Thank you, Laura. And then I have one more question. What are the guidelines for someone who's tested positive and the contacts as far as quarantining? And I think you all touched on this also.
So positive cases should isolate away from others for 10 days from when their symptoms began. Unvaccinated contacts should quarantine for 10 days after the last contact with the positive case, or they could get a test on day 5 to 7 and be released after day 7 if they remain without symptoms.
Thank you, Laura and Amy. Amy, I'm not sure if we have any questions in the YouTube live.
There was one, Tracy, I've tried to monitor that too. There was one, and I think it was Judge Green, and he said he didn't quite get to study the chart I put up, so I put that back up as Laura was talking about it again. So his question was, if you have been vaccinated and come in contact with someone who is positive, what is the protocol? And according to this chart, if you're fully vaccinated, you don't necessarily need to quarantine, but it is still recommended to get tested 3 to 5 days after exposure, as Dr. Wayman and Laura both mentioned, just to see if you're an asymptomatic positive that would potentially spread the disease. It could also be if you're vaccinated and you've been around a positive, your workplace may have different protocols. There are certain situations, long-term care settings I can think of, in hospitals and different healthcare organizations who might recommend a quarantine regardless. So that would be something that you would need to talk to your employer about potentially, because they would maybe have stricter requirements even than we do about protecting their vulnerable populations. But at this point in time, typically, if you're vaccinated and you're in contact with a positive person, you don't necessarily have to quarantine. And I think that was the only question I saw, Tracy.
Thank you, Amy. So I guess you just talked, Amy, but do you have any final comments you want to share with the community?
My final comments are going to be the same probably regardless of what day it is, what month it is. I'm just going to encourage vaccination. We are facing the same numbers that we were facing at the height of this a few years ago, but it doesn't have to be. We have a vaccine in place that can help with this, that can help alleviate the burden of sickness on people and the burden of work on people that are trying to care for the sick patients, and us at the health department even, who are trying to work positive cases and give people instruction. There are things we can do, we can all individually do if we choose to, that will help the situation in a lot of ways. So of course, vaccination, speak to your provider if you have questions specifically about a medical thing, a medical condition that would maybe hinder you from getting vaccinated or that you would consider vaccination. Talk to your providers, but certainly consider it at this point in time, just for your own protection, for the protection of those in your household and those around you. And then I still recommend wearing masks when you're in large gatherings and crowded spaces and places where you're not around people that you're normally around. So anywhere that my family and I go, pretty much that is an indoor setting that's not just us, we wear a mask now. And we had kind of stopped that in the summer because we felt we were okay. We were vaccinated and the cases were down and all that. But as they picked back up, I've certainly reevaluated that for my own self and my family. And I encourage everyone to consider that as well.
Thank you, Amy. What about you, Dr. Wayman? Do you have any final thoughts, comments you want to share?
I just reiterate what Amy said. Basically, we need to get vaccinated. as good as, vaccines aren't perfect, but they certainly make a difference.
I want to thank everyone for joining us today. I do want to remind everyone that we do daily briefs, daily updates about COVID-19 across our district. Those are on our website at lcdhd.org. We are planning to have another community update on Wednesday, September the 1st at 2 o'clock. So if you have questions, you may submit those to us via our website. And that's all I have. I thank you all again for joining us today.
Thanks,
Thank
Tracy.
you.